Hello and welcome to the program. I'm your host, Neal Howard, here on this Health Suppliers segment on Health Professional Radio. I'm glad that you could join us today. Our guest in studio is Anthony D. Cox. He's a professor of marketing and Kelley Venture Fellow at the Indiana University Kelley School of Business in Indianapolis, Indiana. And he's here today to talk with us about a very special program, a 21-month program that is designed to give doctors the business knowledge and skills that they need to navigate this ever-changing world of healthcare. Welcome to Health Professional Radio, Professor Cox.
Thank you.
Thanks for joining us today. Now, this program, is this something that is unique to the Kelley School? And how long have you been involved in this type of program?
It's close to being unique. It's there in the entire United States. There are, I believe, only 3 or 4 physician-only MBA programs. And ours, I think, is unique just because of the depth of the program. It's a full MBA program that spans 21 months that the physicians spend in the program. They come for face-to-face instruction 1 weekend a month in Indianapolis, and then we have online instruction during the intervening week. So it's a very intense, in-depth program. You know, it covers. Yeah, go ahead.
Well, as a consumer, just a regular guy, when I think of a physician, I'm thinking, well, he's been through school, he's got his practice, he's probably got many people working under him. When you're talking about a program that is specifically designed to give physicians business knowledge, is this something that's lacking in their normal medical school curriculum?
Yeah, I think so. I think a lot of them perceive that to be something that needs to be remedied. I think that there's a gap in a lot of healthcare organizations between the people who have the clinical expertise and the people who make a lot of the management decisions, and I think that's to the detriment of those organizations. I think it's best if you have leadership that understands the sort of core business that you're involved with, and physicians have that knowledge, but often are not involved in management, especially senior management positions within hospitals and health systems. I think something in the neighborhood of about 5% of U.S. hospitals and health systems have physicians as CEOs. And that's pretty unusual. If you tell someone from just about any other industry, for example, almost all law firms have attorneys as CEOs, almost all successful universities have academics as presidents. And I think one of the challenges is, if this gap is going to be bridged, is physicians tend to have sort of, by necessity, tunnel vision during their education, where they study biomedical issues, even starting from their undergraduate education. And so a lot of physicians, I think, who want to take more of a leadership role recognize that they need to round out their education by studying sort of the disciplines of business and management.
Now, in your experience with this program and with dealing with many physicians that go through the program, are there aspects of this program that are designed to give a physician the ability to take on those responsibilities without having to have a staff for that? For instance, if a doctor has 40 patients to his practice, I mean, just throwing a number out there, where another doctor is involved with a group that has 20 physicians, all of differing specialties. How specific can this program be based on the physician's needs?
Yeah, well, there are somewhat different issues that are faced by physicians in practices of different size, but there are a lot of commonalities too, I think. In terms of the physicians who have been through our program, they range from sole practitioners, though nationwide that's a kind of declining group in terms of size, but we do have some sole practitioners all the way up to physicians who practice in fairly large group practices, to physicians who are employed by, multi-billion-dollar health systems. And there are some distinctive issues with those, but there are some commonalities. And, all of those organizations, regardless of size, need to make decisions that are fiscally responsible. They need to deal with customer service issues, operational efficiency issues. They all have to deal with insurance companies. So I think there's enough commonality of issues that the program can still be relevant to that range of different practice situations.
How does this program address the different needs on a business level, say, of a cardiologist as opposed to a general practitioner or, I don't know, maybe an oral surgeon?
Right. We try to be pretty broad. We're not training. A lot of the physicians who are in the program are already in leadership positions or want to move into leadership positions that really cover a wide range of different medical specialties. So we don't try to have separate projects that are just relevant to the cardiologists versus the orthopedic surgeons versus the primary care physicians. But we take a very big picture approach. And this starts with the very first term in the program. They take accounting very much tailored toward healthcare. But the other class they take is a unique class. It's called healthcare revenue and delivery models, which really looks at the big picture of kind of how all these components of healthcare fit together. One of the real challenges, I think, for the healthcare system in the United States is this sort of fragmentation, where there are all these different pieces that don't necessarily coordinate with each other. And so we try to take a sort of systems view of healthcare so that it's relevant. I think it's relevant to all of them.
We were talking about the lack of business education during medical school. Is this program geared towards someone who's wanting to get business savvy right out of med school or, say, right after their residency, or is this something that is offered to seasoned physicians? It's
more seasoned physicians. We require that all the physicians at a minimum have completed their residency program, but most of them are quite a few years out of their residency program. The average age of the physicians in the program is probably in the low 40s, if that gives you some idea. Okay. So on average, they've been in practice for 10 or 20 years. Now, there's a range. We've had some physicians, we've had one or two who are still in fellowship programs, all the way to some who are in their mid to late 60s. But kind of the heart of the distribution, I would say, would be sort of mid 40s.
How does this program address certain things like things that will affect a physician's time? Time is money. Things like meaningful use of the computer, or merit-based insurance payments, that sort of thing that's coming into play now during this healthcare transition that we've been in for the last 6 years.
Well, there are a number of parts of the curriculum that address that. One of the sequence of courses probably most relevant to that would be operations management, where we look at there's both a sort of core operations management class where we look at issues of kind of efficiency of delivery, improving quality while also making operations more efficient. And then there also are some positions that go beyond that, and they take a sequence of courses in process improvement, what is sometimes called Six Sigma. And so that they learn how to make processes within their practice more efficient, which is both beneficial to them as physicians and to their practice, but also beneficial to patients. Because as you know, one of the real problems with the healthcare system is patient wait time. Waiting to get an appointment and waiting in the office even after you have an appointment.
Yes, absolutely.
So, yeah, that's a very important kind of subset of the curriculum.
Where can our listeners go and get more information about this program? And the second part of this question is, as this is at Indiana University, do you see a branching out all over the state of Indiana and the university system?
Well, it's offered by the Kelley School of Business at Indiana University, of which I'm a faculty member. And it's the audience, the physicians come from all over the country.
Oh, okay.
So we have physicians from California, from New York, from Florida, and so forth. And so it's truly a national program. I think currently there are probably about 20 states represented in the program, since they just have to be there 1 weekend a month, and then the rest is online.
Okay.
But for more information, probably the best thing would be if you just Google Kelley, that's Kelley, physician MBA. We have a great website that provides a lot of information, detailed information about the program.
Great. Well, thank you for coming in today, Professor.
Thank you. I really enjoyed it.
Great. You've been listening to Health Professional Radio. I'm your host, Neal Howard, on this Health Suppliers segment. I'm talking with Professor Anthony Cox. He's a professor of marketing and Kelley Venture Fellow at the Indiana University Kelley School of Business in Indianapolis, Indiana. He serves as the faculty chair for the Kelley School's Business of Medicine Physician MBA program, which is exactly what we've been in studio talking about this afternoon. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud.